Hi there, I'm the neuromuscular mechanic, and today we're going to be talking about ultrasound-guided chemodenervation of the quadriceps and sartorius. So the muscles we'll look at are the rectus femoris and the three vasti that make up the quadriceps, as well as the sartorius to finish. The disclaimer, like my previous videos, what you're seeing today is normal echo texture from my muscles. Appreciate that individuals with spasticity, their muscles may look different because of increased echogenicity. So we start with the quadriceps. So if you take your ultrasound probe, typically a high-frequency linear probe, and put it in short axis over the anterior thigh, I try to find a spot where I can identify all four muscles of the quadriceps. And I can use this as a starting base to then move either the probe proximal to distal or medial to lateral to better appreciate the individual muscles. So what I'm doing here in this video is I'm starting in short axis at the level of the knee, and there's the anechoic cartilage off the trochlea of the femur. And what I'm going to do shortly is, again, in short axis, I'm going to move that probe more proximally. So here I go, moving more and more proximally. And as I keep going up, probably the distal 1/3 of the thigh, I'll have this view here where I can see all four muscles of the quadriceps. So I have in the middle the RF, or the rectus femoris, deep to that the VI, or vastus intermedius, and then medial the VM, or vastus medialis, and lateral the VL, or vastus lateralis. And then what I can do is, if I want to better appreciate the rectus femoris, I might have to move the probe a little bit more proximally. So again, here's the RF, or rectus femoris, and there's the VI, or vastus intermedius. And once I know where the rectus femoris is, then again, I can move the probe, translate either medial or laterally if I want to appreciate the vastus medialis or lateralis. And that's what I'm going to do here. So I'm going to translate that probe medially, and there's the contour of my VM, or vastus medialis. And then shortly, I'm going to do the opposite, where I'm going to translate the probe laterally. So just going up and down the bulk of the vastus medialis, but then I move it laterally. There's my rectus femoris, and then there is my VL, or vastus lateralis, and then deep to it, overlying the femur, is the vastus intermedius. So again, that home base with all four muscles works best. So with these muscles, there's no recommended dose on the monograph. Appreciate that if somebody is ambulatory, there is the risk of weakening the quadriceps and potentially worsening gait with these injections. With the sartorius, I start with my probe in short axis. If you remember, the sartorius originates from the ASIS, or anterior superior iliac spine, so you can start there, and then the sartorius will run at an oblique angle medially towards the pes anserine. So if you go in that sort of approach, you can identify the muscle. And one key point is that it has a close and intimate relationship to the femoral vasculature. It's often overlying these blood vessels, particularly just distal to the femoral triangle. And so we'll talk about that in the videos. So here I have the ultrasound probe in short axis. There's the bony contours of the anterior superior iliac spine, or ASIS, with that acoustic shadowing. Now I'm going to shortly start moving that probe distally and then slightly medially in short axis. And so there I go. You can identify the sartorius muscle coming off the ASIS. And then what I'm going to do shortly is I'm going to, again, move that probe more distally and slightly more medially, and we're going to appreciate the femoral vasculature start to come into play. So again, going more distally, more medially, keep going. Several finger breaths below the femoral triangle, and there I have it right there. I'm going to pause. And so there's my overlying sartorius with my femoral blood vessels. And again, this is important because sometimes you can't see the outlines of the muscle belly so well if things are hyperechogenic, but if you know where the blood vessel is, you can have a good understanding of where the sartorius is. So in a second here, I'm just going to activate my sartorius by doing some hip flexion and external rotation. So there it is, contracting. And then I'm going to move the probe slightly more distal and medial. And again, you see that relationship where it's overlying the femoral blood vessels. So with the sartorius, like the quadriceps, there's no recommended dose for Dysport or Botox, and appreciate that it is close to the femoral blood vessels. So that ends the videos. I'm the neuromuscular mechanic, and I hope you found today handy. Thank you.